Enter the room.
Hello, and I'm one of the doctors here at this department. Can you please confirm your name and age for me?
Well, doctor, I can't cope at work.
Mm-hmm. Uh, so I can see from my notes that you are Tanya Higgins. Am I right?
Yes, that's correct, doctor.
Okay. What would you like me to call you?
Tanya is fine.
Okay, Tanya, can you please confirm your age for me?
I'm 35 years old.
Okay, Tanya, how can I help you today?
Doctor, I can't cope at work.
Okay, can you please elaborate a bit more for me? What do you mean by that?
Well, for the past 6 months, I've been feeling a bit overwhelmed at work. I've been making mistakes, and I actually started this job 8 months ago, but for the past 6 months, I've just been feeling very tired. I feel like I'm bringing my
Mm-hmm.
work home, and I can't catch a break.
Okay, I do understand it's very overwhelming for you at this time. So you told me that it's been for 6 months. You are feeling so much tired. Am I right?
Yes, that's correct, doctor. I don't know what to do.
Mm-hmm. And do you feel this tiredness all the time, or it comes and goes?
Well, like I said, it's been every day feeling
Mm-hmm.
tired, feeling overwhelmed for the past 6 months.
Mm-hmm. Is there any particular time of the day that you feel more tired?
Well, I feel very tired at night. Actually,
Mm-hmm.
I've been having sleeping problems, going to
Mm-hmm.
bed at 10 or around
Mm-hmm.
11, but I
Mm-hmm.
can only get to sleep at 2 a.m. and then
Mm-hmm.
I wake up at 5, so I'm really struggling.
I understand that is very struggling phase for you at this time. So, what do you consider that? What makes you wake up?
Well, you see, I work as a software engineer and I've just been struggling to balance my life together with my
Mm-hmm.
work, so I don't
Mm-hmm.
know what to do.
Mm-hmm. So, how your mood these days?
To be honest, doctor, my mood is very low. I feel inadequate
Mm-hmm.
and useless at
Mm-hmm.
work, and
Mm-hmm.
sometimes it
Mm-hmm.
makes me feel guilty that I'm leaving extra work for my coworkers.
Mm-hmm. Mm-hmm. And what about your concentration, Tanya?
Well, I would say my concentration was affected, but I've just been feeling tired at work.
No, it's very hard for you to cope with all this situation. It's quite understandable. Tanya, what about your appetite? Are you eating well?
Well, my appetite hasn't been affected that much.
Mm-hmm. And are you have you been noticing any change in your weight?
I haven't noticed any change in my weight, doc.
Mm-hmm. Mm-hmm. And do you enjoy the activities that you previously used to enjoy, Tanya?
No, doctor, I used to enjoy cycling, but now I
Mm-hmm.
don't really find
Mm-hmm.
interest in it. I don't
Mm-hmm.
even exercise anymore.
Mm-hmm. 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 Do you consider that your life is worth living?
Well, to be honest, yes, I know that I have responsibilities at work and I have my husband to go back home to. So I
Mm-hmm.
think life is worth living, if that answers your question.
Mm-hmm. Tanya, sometimes people feel this way. They think to harm themselves or the others. Have you ever thought of this thing, like this thing?
Not really, doctor. I haven't really been suicidal, if that's what you're asking, but I just
Mm-hmm.
feel tired and I'm feeling
Mm-hmm. Mm-hmm.
inadequate at work.
Mm-hmm. And a few more questions. Do you feel sometimes people will, when they are feeling this way, they start listening or seeing the things that are not seen by other people or listened by other people? By any chance, have been the same case with you?
No, I don't think I've been seeing or hearing things. I haven't felt that way.
Okay. So a few more questions regarding your general health. So, do you have any medical conditions previously?
No,
Any medications you might be on?
no,
Any allergies?
none.
Whom do you live with?
I live with my husband at home.
Is is he sportive?
Sorry, I didn't get that, doctor.
Is your husband sportive?
No.
Mm-hmm. And what kind of relationship you people are owning?
Well, our relationship is fine. I would say it's okay. No
Mm-hmm.
complaints.
Okay. So do you have any kids?
I don't have any kids. We don't have any kids.
Mm-hmm. So you are having this all of the problems. Do you consider that anything particularly happened previously that led to this condition?
I think I might be having depression, doctor, and I'm worried that
Mm-hmm.
my performance at work will make me lose my
Mm-hmm.
job.
Mm-hmm. I do understand that is quite worrisome for you. Thank you so much, Tanya, for answering all of my questions. You told me that you are feeling tired, you are not able to concentrate properly, and your mood is also not good, and it's
2 minutes
to
remaining.
not sleep at the night. So I believe that you are suffering from a condition what we call is depression. Do you have idea what it is?
I've just heard about it, but I would appreciate if you
Mhm,
explain it for me.
mhm, mhm. Let me explain it for you. It's a condition in which the person's daily life is affected in many aspects, as you are having this problem with the sleeping, with the mood, and working. So I believe that you need some kind of help from us. Are you okay with it?
Yes, I'm fine, doctor. How will you help me?
Mm-hmm. Mm-hmm. I'll be definitely helping you with that. I have a plan for you. Like I will be arranging some sort of counseling sessions for you to help with that situation. Okay.
All right, doctor, that's fine.
They will be arranging different sessions on different times, in the start they will be arranging this session on the weekly basis, and later on they will be extending this sessions for you. They will be helping you to understand your feelings and to cope with your feelings that you are having. This will be making a much improvement in your all the problems that you are having. Are you able to follow that?
Yes, doctor, I can follow that, but
Mhm.
what
Mhm.
will you
Mhm.
give me to
Mhm.
help me with my sleeping
Mhm.
problems?
Yes, yes, it's quite understandable that it's quite concerning for you. I'll be definitely giving you the sleeping pills for right now for 1 or 2 days to help you cope with this situation. But Tanya, it's not a good idea to give you the sleeping pills in the long run, because I believe that it's not going to help you in that way. Okay.
All right, I understand, doctor.
Mm-hmm. And in addition to that, if it is not helping you in the start, you will be continue with that.
Move on to the
It will
next
be
station.
okay.
All right, guys. Good job. Thank you, Dr. Farao, for that great performance. And absolutely, Dr. Nikhat, good job. I have a few tips for you, actually. There was a point where
Mm-hmm.
you already asked where, you have a condition
Mm-hmm.
called depression. Do you know?
Mm-hmm.
I mean, he himself, is kind of giving you
Mm-hmm.
that hint.
Mm-hmm. Yes, yes. A person can recognize his own mistakes most of the time, that what he or she has done. I already recognize this. Oh, what I have done, but the time is skipped at that time from my hands.
Absolutely. So I know it comes like a second nature to keep asking, do they know the diagnosis? But in certain
Mhm.
cases like these, they actually do know the diagnosis. Don't actually emphasize on the fact that you haven't heard the fact, you'll get
Mhm.
picked for listening for that, because he's
Mhm.
already expressed himself
Mhm. Mhm. Mhm.
in
I
actually
must be careful. I always consider this thing as a part of my learning, and I always take this sort of mistakes in my positive way. That this will be kept in mind forever. That I have done this, I'm not going to repeat it again.
yes, that's a good attitude towards that, definitely. So ultimately, by the end of the what I'm trying to emphasize is when you're actually talking to the patient, try to have a
Mhm.
conversation. So he's already told you that he thinks it's depression. So use that
Mhm.
information in framing your diagnosis. From what you've
Mhm. Mhm.
like
Mhm.
having something like depression, as you suspect.
Mhm.
No,
Mhm.
actually having a conversation. It's not like you're actually giving out a script in a way. Otherwise it's
Mhm.
very scripted that way. Like he already said it's depression. He's like, have you heard of it? Like,
Yes, yes, yes. It's a mistake on my part.
so by the end of the day, it's a conversation. So always try to do that. And I feel you
Mm-hmm.
get very impulsive when you kind of have to say something. So, you know, just
Mm-hmm.
move them along. You don't let them finish. Always
Okay.
let the
Okay.
patient finish, because whatever they have to say,
Mm-hmm.
that's just adding a clue. So, you know, sometimes
Okay.
you just try to move them along by, you know,
Mm-hmm.
your question,
Mm-hmm.
finished answer.
Mm-hmm.
Make sure
Okay. Okay.
to do that.
Mm-hmm.
You know, you will
Okay.
definitely get picked for listening, and
Mm-hmm. Mm-hmm.
that'll also take a big toll on your interpersonal skills and management.
Mm-hmm. Mm-hmm.
Do keep an
Mm-hmm.
eye on that. Otherwise, great
Mm-hmm.
questions. So, what do you guys think it
Mm-hmm.
is? What do you think it is this patient has? Okay, fine, it's depression. Yeah, you got it. But what are the aspects you're looking at? You know, like, what are the aspects that you know? What are the different features that led you to believe that it was depression?
Different type of the features were there, like they were not able to sleep, there was low mood, there was tiredness, there was concentration problem, and there was not ability to enjoy the things. Multiple things were there.
Absolutely. Do you know what are the core features of depression?
Yes. Some situations related to the relation, some situations related to finances, loss of someone, something
So
like
all
that.
this, I'm asking, do you know the core features? When to call something depression, when to understand if it's depression, and to start grading this.
Okay, okay.
Do you know?
Uh-huh. When it starts affecting the daily activities of a person, I believe.
All right, that is all right. So, when you're talking about depression, there are two core features. So, the whole idea of
Mm,
depression comes with something called the DSM criteria. The DSM-5
okay.
criteria is something that they use, and what they actually
Mm,
do to assess depression is something known as a PHQ-9 questionnaire, which is a
yes, yes, yes.
health question
Mm-hmm.
9.
Major depression or minor depression. I got.
Yeah, yeah. I'll just finish what I have to say first, and then you can
Mm-hmm.
chime in. So, when you're actually talking about depression, always, even in DSM-5 and DSM-4, the two features, it's either you ask for mood or anhedonia.
Mm-hmm.
As soon as you get mood or anhedonia present, you have to start
Mm-hmm.
looking at the other features. So, those are known as the
Mm-hmm.
biological features, meaning how is it
Mm-hmm.
affecting, like, their concentration, their energy, their
Mm-hmm.
self perception, like do they feel hopeless, do they feel worthless, you know, those are all
Mm-hmm.
that you can actually you know, there are a total of around 9 criteria, out of which 5 need to
Mm-hmm.
be positive for it to be called
Mm-hmm.
depression. So
Mm-hmm.
when you're thinking along those lines, definitely ask those criteria. So as soon as you get the core criteria correct, if you get a core
Mm-hmm.
criteria, you need to understand
Mm-hmm.
aspects. Now, what are the stressors? Why is this patient feeling depressed? What is depression? Anybody? Dr. Farao, you were simulating. So, what would you say
Yes.
was the cause for this depression?
Sorry, I didn't get that question. Can
What
you
was the
please repeat
cause?
it?
What was the reason behind the depression? How would you manage this case? What would you give for management?
I think the patient was getting depressive symptoms due to the overwhelming workload in this new job because the symptoms started 2 months after she had resumed the new job. So I think
Absolutely.
maybe she could have benefited from some maybe cognitive behavioral therapy to
Absolutely.
help her and to manage the workload. Yes.
Sure, that's absolutely correct. And a couple of doctors have also mentioned it on the comments. Dr. Guitima, if I'm not mistaken with the name, and Dr. Prabha has also written something about, you know, the duration to which you can call something a depressive disorder is 2 weeks or more. So that's absolutely correct. Yes, new job, that was the stressor, that is the cause. What is the cause? So understanding a little bit about the lifestyle here, you understand that there is a cause for which she's feeling that. This is like an overwhelming work situation that's causing her to be depressed. This depression is in turn worsening her performance at work, where she's not able to sleep, there is a lack of concentration. And so the best thing to do would be to first, try to address the situation, to the work colleagues, like address it to your manager, right? You can actually talk to them, for a fair allocation of workload, right? The other thing you can do is you can actually give them a sick note, so that they can take a break and they can just, recollect, and, they can, manage to, perform better, right? Those are all important aspects that you can offer as like an immediate management. Otherwise, the other things you can offer is cognitive behavioral therapy, and another one that is very important and does get overlooked a lot is interpersonal therapies. So interpersonal therapies are the way to go in these cases, especially when there is, work stress, any divorce, grief, or any loss of person grief. Interpersonal therapies are the ones that you actually do recommend, right? If there's any thought disorders, those are when you actually give cognitive behavioral therapy. This is actually a very interesting, field to actually understand a little bit more. But cognitive behavioral therapy or interpersonal behavioral therapy, these are all therapy sessions. So it would actually, translate to either. So yes, let's quickly look at performance. Dr. Ashley Marcus. So thank you, Dr. Ashley. Identifiers, patient confirm full name, age, clarify presenting complaint by exploring when the symptoms started, what triggered them, and how they evolved. That's very good. Assess core depressive symptoms, ask about mood and anhedonia, and then the other ones like fatigue, low energy levels, explore associated depressive features such as guilt, low self-worth, difficulty concentrating, and feeling of hopelessness or inadequacy at work. Evaluate sleep pattern changes, particularly difficulty initiating or maintaining sleep, early morning waking, and non-restorative sleep. Investigate any previous episodes of depression or mental health issues. Assess any red flags such as suicidal ideation, self-harm psychosis. Yeah. The parts that were partially covered. Take a psychological history, including support system. Ask if she actually has support, like partner, friends, occupational stress, recent life change, coping mechanism. Inquire about lifestyle factors, like how is she coping with it? What are the different things she's doing, right? Such as diet, exercise, alcohol, substance abuse, or any significant weight change. Otherwise, things that were missed out, rule out other differentials such as hypothyroidism, anemia, by asking about cold intolerance, weight change, menstrual irregularities, and palpitation. Perform MMSE just to understand if she's not having any psychosis features, right? Conduct relevant physical examination and bedside test to rule out any other cause. Management, explain the diagnosis of moderate first episode depression in simple terms and relate her symptoms to it. Reassure about treatable nature of depression and normalize her experience, explaining that many people go through this. Offer psychological therapies, refer to IAPT services for CBT or interpersonal therapies, especially due to work-related stress component. Discuss pharmacological treatment options, explain SSRIs like sertraline are effective, but typically not first line unless symptoms worsen. So these are patients who will be on a follow-up with you. Now, since it's actually affecting so many aspects of her life, you can actually try giving her SSRIs. But when you mentioned about sleeping, you should first give the first line treatment to sleep hygiene, right? Understand if there is any excessive intake of coffee, or if there is any excessive daytime sleeping, or any other components, or excessive screen time. So try to emphasize on the sleep hygiene before you go into medications. Medications is, if you have a routine, and if you keep, Dr. Farah, I'll just make this point and then we'll have your question. So if you already have a routine, and within that routine, if you can manage to sleep, and if the medications help you sleep, you can actually bring about a circadian rhythm. So you can give medications, but you have to make sure the instance where you are giving medications is not something that would be needed for a long-term thing. So you need to first implement a sleep hygiene, and then you can offer medications. Yes, Dr. Farao, go ahead. Your question?
All right, thank you. I just wanted to ask the role of sleeping tablets. That I remember to something about that. Is that appropriate according to NHS guidelines or NICE guidelines?
Yeah, sleeping, of course, you can give sleeping tablets as well, but then that is always, it's not the first line. So this is what I'm trying to emphasize, sleeping tablets also, like the benzodiazepines that you give, they have a lot of long-term effects along with the issue of dependence, right? So you do not want to get them hooked onto this. So you want to, you need to make sure to get them into a routine or a lifestyle where they are not dependent on the sleeping tablets. So first try to set a routine, and then to improve that hygiene, you can offer them sleeping tablets over a period of time, right? Like a week or two, but you need to have them on follow-up regularly. So if you give a medication like, benzodiazepines or even antidepressants, you need to have them on a follow-up, regular follow-up, and it's a 2-week follow-up. So, or even 1-week follow-up you can do for them. So do understand, like, depending upon the severity, do understand when to give the medications and to see how it's affecting them. So even though you have offered the medications, you can't let them go just by giving them medications. You need to see how it's actually, improving them, and what you can institute in order to give, what augment the treatment plan and to improve it. Yeah, does that answer your question? All right. So discuss
Yes,
lifestyle
thank you.
modifications. Absolutely. Promote sleep hygiene, avoid screen time. So definitely first try to avoid, promote sleep hygiene and then medications, right? Discuss stress management options, including NHS approved apps, stress relief techniques, or local workshops. Assess suicidal risk and create a safety plan if necessary. Safety net appropriately, advise on warning signs such as worsening of mood, suicidal ideation, when to seek urgent help, the Good Samaritan number, the crisis team. Arrange a follow-up in 2 weeks to review the progress and the response to therapy. Sooner if medication started. The plan ongoing follow-ups every 2 to 4 weeks. Provide patient education on depression and treatment options. Yes, absolutely. All right then, and interpersonal skills, what one is, be sensitive to cultural and personal factors influencing their experience and treatment. Signposts explain the process, and what to expect during the consultation. Yes, absolutely. So that was Dr. Nighat. And yeah, well, thank you everybody for joining. That brings us to the end of today's session.